Hi, and welcome to Beyond. Today we have a special guest, Johanna Bruner, who's a former director of cardiology services at UCLA and is currently the department chair of the School of Nursing at California Southern University. And she's here to correct some of the common COVID-19 myths that exist out there today, with whether it be the media or among water-cooled talk. She's here to really help us. Johanna, welcome.
Thank you. It's a pleasure to be here.
Yeah, so glad to have you. So, prior to COVID-19 and certainly during this pandemic, there's some myths around the sterilization of common household items, to how you can prevent it, to just crazy out there ideas about how to protect yourself from it, prevent it. And so what I want to do is kind of go through some of the myths that are out there today, and hopefully you can help clear some of those up. So the first myth is hair dryers can kill the novel coronavirus, and somehow increasing the room temp will help prevent the spread. What do we know from literature, or what does your expertise tell you?
Well, right now, there's a lot of hope that heat or warm weather will in fact kill the virus, but there's absolutely no substantial scientific data surrounding that right now. So I know in the beginning, just to back up a few steps, people are like, well, it's going to be summer and the heat from the summer will kill this. And there's nothing to back that up. As far as anyone thinking in their wildest imagination that if you took a hairdryer and either held it and blew it up your nose or blew it in your face, that you would kill a virus, I'm not even sure who came up with that myth. All I know is that for those of us, men and women, who use hairdryers, you know what that feels like when it's blowing against your hair. If you can imagine opening your mouth or putting that up your nose, I would be hard pressed to not have somebody understand how injured they could get by doing that. The force of the air, blowing air into you when you're supposed to be breathing air out, blowing germs or dust or whatever happens to be around into your body rather than letting it come out naturally, and simply burning the fine mucous membranes of our nose and our mouth would be treacherous. So don't do that. That is setting yourself up to actually injure yourself rather than hurt yourself. And it's not going to kill anything except maybe yourself and the tissues in your lungs and in your nose and in your mouth.
Yeah, if I can unpack that, you bring up some points, and I think the media has trafficked in fear, if you will, because there's so much information out there. And quite frankly, even the experts are trying to come up to speed on what is coronavirus and what is its ultimate impact and what are the signs and symptoms. So I think there's a lot of fear-based approaches out there that, Joe Public Citizen is trying to employ to protect themselves because they, in their minds, should rightly be afraid. So there's that element. And then there's the element where they're trying to take action. And what you said is a really important point. If you hurt yourself or burn yourself, you can't necessarily, or you don't necessarily want to go to the hospital, right? Because that's where you could potentially contract coronavirus. So, you really, it's kind of a double whammy, if you will. And I think that's really great advice you offer. And the other thing I'd say that you brought up that is really important is that in our world of, medical devices, UCLA hospitals, you guys operate on the scientific method, meaning that it's really about the data that guides the decision-making and that guides the treatment and therapy. And I would argue to people out there that unless you have a well-developed study, just going out off of anecdotal commentary or thoughts could be really dangerous, and to really look to the data to guide your decision-making.
Well, Ben, I think you bring up some fantastic points, and I want to focus for a second on one thing that you said. This illness and everything that's going on right now, this entire pandemic, is completely fear-driven. And when something is fear-driven, it's very hard for those of us, for all humanity, all people, no matter what your age is or where you live, not to internalize that and become incredibly anxious. When you're anxious, you tend to do things that don't make sense because you want to believe there's something out there that can truly help you. And there are things that can truly help you. But fear is a funny thing, and it drives us to do things that we wouldn't ordinarily do. And then what happens is that you set yourself up for accidents, you set yourself up for injury. So you're basically doing the opposite of what you should be doing. If you can and again, I think your use of the words a scientific approach is very, very valid. Now, there's many people that won't understand that, and that's okay. Simply what that means is there's science behind everything that we do, even the smallest thing. And if you pay attention to the science, then you're less apt to get caught in the fear and the anxiety and do something silly.
Right.
So,
That's a great point. Great point. So the second myth you sort of touched on is that people believe if I go to a hot, humid climate, it'll protect me from COVID-19. So we went from the blow dryer to I'm going to go out in the desert in maybe Arizona and I'll be good. What does the data suggest on that?
well, take a look right now at Rancho Mirage, Palm Springs area. Their temperatures are heating up right now. They have got some very scary statistics in terms of the coronavirus, appearing. Why? First of all, it's an older community. And if you look around the world, older communities, including the horrific things that are happening in nursing homes, are prime places for this virus to develop. Because the older you get, the less your immune system works correctly. In places like Rancho Mirage, you've got people that are doing many, many social things. That's the life out there. So the more social you are, the more likely you are to spread it. You look at Italy, and we'll step out of our own country for a moment. It's a very elderly population in that country, and it's very condensed. So if you're in the desert, that is not going to stop you from doing anything except maybe going out when it's 150 degrees outside, which is just the desert's way of saying social distance, stay in your house because it's too hot for you to be out here anyway.
That's right.
But it's not going to kill the virus.
Right.
So
those are great points. And so the next myth I read is mosquitoes can spread COVID-19. As I read more about this, since this is a respiratory disease and not transmitted through the blood or doesn't stay in blood long, what are your thoughts on the idea of mosquito-borne spread of COVID-19?
Simple. There's simply no scientific evidence to back that up at all, period, end of story. And because we blame mosquitoes on carrying pretty much everything, we do know they carry a lot of bad things. They carry many, many things, but coronavirus, COVID-19 isn't one of them. There's no data to back up that myth at all.
Okay, that was good. What about the one where ibuprofen can make COVID-19 infection worse? Is there any evidence that supports that?
I haven't read the studies on it, but the studies, the things that I do know, don't substantiate that. Does it make it better? I don't know. I haven't seen a study with 1,000 people who have taken ibuprofen, and they're worse. But what you do see is, has anyone pulled it off the market? No. Has anyone said, okay, if you have any flu symptoms or any symptoms of any illness at all, and remember that some of the COVID-19 symptoms do mask flu. There's a lot that are different, but some of them do. There's also about a gazillion respiratory illnesses out there that start out with the same symptoms.
Right.
And we have to be careful of that as well. So if there was truly an issue with ibuprofen making it worse, they'd be pulling it off the market. They would be saying, don't use this at all for anything because you don't really know what you're treating in the first place. And you haven't seen that happen.
Well, that's a really solid point there. So the other thing I've seen is, hey, only older people are at risk for COVID-19. And yet I've read where younger people have contracted COVID-19. So what are your thoughts on that myth?
Let's just blow that one right out of the water. If you see, again, let's go back to a nursing home where most of the patients there are elderly and it spreads like wildfire through the home. Well, they're elderly, most of them have underlying health conditions, and they're going to get sick and not do well from it. But if you saw yesterday's news, there is a syndrome that has been identified in children, and there's about 12 children so far in the States, probably more, that are developing this syndrome that is being linked directly to COVID-19. Europe is now coming out with new studies that is showing the same thing. We have babies that have died from this. We have young people under the age of 12 that are getting sick. Is it the numbers as significant as in the older populations? No, it isn't. That 49 to 65 age group seems to be the hardest hit group. And also, you've probably noticed that there are certain ethnic groups and nationalities that are being harder hit. We're not sure why that is yet. So to say, oh, it's only the elderly, or it's only this, or it's only that, no, it's not. It's hitting everybody. It hits those that are immunosuppressed or have underlying diseases, and you can be any age with an underlying disease. Diabetes has no age limits on it. High blood pressure, you can be 20 and have high blood pressure. But the most significant and interesting information is this new syndrome that's been identified and released to the public in the last few days, with groups of young children going to the hospital with symptoms that are unlike anything they've seen before and are being treated in this, probably 10 to 12-year-old or 9 to 12-year-old age group. So that kind of dispels that myth as well.
Yeah, it's funny about COVID-19. We just honestly, we're sitting here today and we really don't know a lot about it. I'd even say the experts don't know a lot about it. And it's going to be 6 months from now, a whole order of magnitude different of what our understanding is, because it seems like a whack-a-mole that once you whack down one symptom, another one pops up. And the strain seems to evolve, if you will. And I was reading an article, and this is very troubling since I'm in the stroke business. They have 20-year-olds and 30-year-olds coming in with full-on large vessel occlusion strokes. And what they found was when they removed the blood clot, they'd see clots form in the moment. So they're removing a blood clot, and all of a sudden the blood's starting to clot again. And these neurointerventional radiologist guys are just flummoxed by what is going on. And that's probably an inflammatory reaction for that patient. And certainly it doesn't hit every patient equally, but that's what's interesting about COVID. It's unique, I guess, in the sense that it's a designer for the person it's in, or the carrier. And it really seems to react differently from person to person.
Yeah, that's a great way to look at it, that it's a designer for the host that it's in. And I think that's exactly what it's doing. I have a couple of things to say about that. I think it plays to whatever the weakness is of the particular host that it is in. And since everyone is slightly different, it's going to affect everyone slightly differently. The clotting idea, we know it's had an effect on blood clotting. It could very well be that it somehow is affecting clotting factors, which would also explain what you just described. If you remove one clot and all of a sudden, there's another clot that's developed. The other thing is that and this sounds very silly perhaps, I don't think this virus knows what it wants to be when it grows up yet. I think that it evolves, it takes on new information. And by the way, you may have read recently that there's a new, more powerful strain that's out there. That sort of happened at the very beginning. The initial strains that were identified were followed shortly thereafter by some more potent strains, which is the strain we're dealing with now. There's not been a new strain in the last 5 days or something of that nature.
Right.
But as it evolves, as it touches different hosts with different body chemistry, for lack of a better way to say it, and I don't want to make this so technical that nobody understands what you and I are saying, it seems to say, oh, gee, today I think I'll do this and see how that works. Or, gee, this host has got a little bit something different about them. I wonder what havoc I can wreak on that. Now, I don't know if you've heard, this is one of my favorite COVID symptoms, if there could be a favorite, about corona toe or COVID toe.
I've heard about it. What is it?
So COVID toe, it appears there are a subgroup of people the ends of their toes become red, a little bit inflamed, a little bit sore and itchy, with no other symptoms. And they went to the dermatologist, and the dermatologist was dermatologists, let's put that in the plural, was suspicious and tested them, and they tested positive for COVID-19. It's not a huge number, but when you look at these toes, it's almost as if all the tips of your toes have swollen a little, become red, a little bit flaky. And again, it has to do with blood flow, circulation, clotting factors, and all of the things that we were just talking about. Is it a huge percentage of people? It's a large enough percentage that it's got a name right now. So you may have no other symptoms, no cough, no fever, no body aches and pains, but you've got COVID toe. So how would you even know if you felt perfectly fine and you look down at your feet and your feet look funny that you should probably call the doctor and get tested?
Yeah.
So again, it's an evolution of this very interesting, complex virus that seems to play off whatever opportunity, and it's an opportunistic virus. So it plays off whatever the host has that may be a little bit different, and then changes itself to evolve into whatever, to whatever new iteration of itself it wants to be. And that's pretty darn interesting if you think about it.
Well, it brings me back to some of the maybe conspiracy theories, but in the lab in Wuhan, the idea of the coronavirus jumping from a bat to a human can't happen unless there's some modification. One could argue that they were studying that in the lab. That, okay, fair, I'll give them that argument. But the idea that this thing is almost a designer drug virus or designer virus. And there's a popular game, I can't remember the name of it, but basically it was, how would you take over the world? Well, you would spread a virus. And the way the virus would work is it doesn't come on full bore, right? It comes on very subtly in the host. But over time, it starts to build and build and build, right? And eventually it takes out the host. And when you see what's going on, I've read reports where a person gets coronavirus and then they're through it and all of a sudden they test positive a few weeks later and then again test positive and they have other symptoms. So it's interesting. I understand there's a lot of biowarfare. There's countries that have invested in it, but it almost feels like a virus that can go out very on the down low, if you will. And for certain people that have contracted, it's not down low, it's impactful. But for others, it sort of evolves over time. And it is curious as I look at this, and I think this is part of what spreads the fear. People trying to get certainty around this virus, that it's X, Y, or Z, and here's how you treat it. And today it seems like it morphs and it changes, and it definitely is challenging the brightest minds on the planet.
Yeah, I agree with you completely. I think it, and I want to clarify one thing really before I go on. There's many coronaviruses, and all of them have identifiers. So whether it's SARS, and actually the true name for this particular coronavirus, 19, starts with SAR, corona, blah, 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 blah. There's a long scientific.
Good point. Good point.
19 only refers to the year in which it came to light. So that's what the 19 mean. It's not the 19th coronavirus. It is the year 19 that this virus kind of hit the forefront. But there's many different ones, and some of them are relatively benign, and some, like this new one, this new baby virus that's growing up in us as its hosts, is curious and a little bit more complex. And because of the nature of how viruses spread, everything you said is potentially viable, possible. There are many, many bacterias and viruses over the years that have in fact spread from bats or reptiles or whatever the case may be. I don't even think we know a smidgen of what's actually been passed on over the years.
Right.
The fact that they took a bat into a lab, and as you said, all of a sudden it escaped, and voila, here we are. Maybe it happened, maybe it didn't. Maybe if it happened, it was because they found the virus and they're like, we need to study this so we can figure out a way to prevent it. And it got out of hand. Who knows? I'm not a blame person. I think it's really counterproductive to blame anybody for what we have today. What we need to do is try to understand it, which we're doing, and understand what we, as its human hosts, can do to back it off, to get rid of it, and to protect ourselves from it.
Yeah.
That's the most important thing. There will always be conspiracy theories, always, because it's no fun if there aren't. And I say that with a little bit of lightness, because I don't think you or I can remember a time or an event or a major happening, no matter what it is, whether it's an illness, whether it's a terrorist attack, that doesn't have conspiracy theories behind it. because we've got a subset of people that can't exist without developing those theories.
No, I think that's right. And that's why I think you need the scientific method and be fact and database.
Absolutely.
And what you rely on ultimately is, do you trust the government? Do you trust the people delivering that information? Do they have character and integrity? And I think certainly people I've come across in the science and medical community, they're all real, genuine, rich people that are trying to do it for the right reasons. But, there's always, I agree with you, there's always those people that will lock into the conspiracy theory because that gives them purpose and meaning. To your point, though, I think we need to understand how we got here and how to prevent it, because, boy, what an impact to the world. And again, we still have a lot of people, and I still say we're still in uncertain or uncharted waters, but, I think we'll definitely get through it. So let me go to the next myth. That wearing a mask will protect me from COVID-19. I thought the purpose of a mask was to prevent me from spreading it. So can you sort of work through this idea of what masks actually do provide in terms of protection?
Well, I think as we've all found out, there's many levels of masks. So the N95 mask used by healthcare workers is a very, the filters in that mask will filter the most minute particles and prevent them from getting into you and prevent anything you have from getting out. The masks or face coverings that we're wearing or we've been asked to wear, they're not designed to do that, which is why, it's been said just you can use a bandana or you can use anything to cover your face. The concept is that you're keeping you into you, and you, Ben, are keeping you into you, and therefore I'm not sharing with you and you're not sharing with me, and we're going to have a level of protection. But
Right.
They're not designed to prevent, the filtering systems in a piece of cloth are not designed to prevent the virus from coming in. What they're designed to do is keep the person wearing them safe and keep the other person wearing it safe. And if two people are doing it, then you've got a double barrier and you're protected. So you're protecting you from you, and the other person is protecting themselves from themselves. But unless you have those very highly sophisticated masks, which none of us should be wearing because our healthcare people really, really need those masks, they're the only ones that are actually going to filter the virus out, prevent it from coming into you. So I think, it's an understanding. It's like anything else in technology. What's its purpose? Its purpose is to keep our breath in and not spread it to our neighbor. If our neighbor is wearing it, they're keeping their breath in and not spreading it to me. And so we have a double element of safety. And that's really the concept behind it. Is the mask going to protect you ultimately? I think if you use everything correctly and you social distance so that you're 6 foot away from another person, you've got a really good level of protection.
But I also read on the mask piece that, if you're getting the vaccines every year, there is an aspect of COVID in the vaccines that they're injecting you. It comes from dogs. So the idea of having a mask on that I'm breathing into, I'm almost like breathing in that part of it, right? The COVID. This is the argument a virologist was making. And the idea that if you really want a stout immune system, you have to get it out there in the world as opposed to like sheltering in place. The problem is we're an organism that really relies upon getting our body tested every day, our immune system tested to make it stronger. So what would your argument be on that idea or notion that, hey, maybe wearing a mask, it maybe protects you or other people from you, but breathing in your own breaths, and if you've had the vaccination, that you're really just breathing in your own COVID probably isn't helpful.
Well, I mean, it's not hurtful. And I haven't heard anything about what the composition of the new vaccine is, so I can't really speak of that. I can speak of what I know is in the flu vaccine, which is, one would think and hope that we can develop something that is as effective. And when I say is as effective, the flu vaccine's effectiveness varies every year.
Yeah.
So some years it could be 49 to 50% effective. Some years it could be 50 to 60% effective or higher. Those are dead viruses. The idea that there's something live in there that's being injected into your body is not correct at all. There's nothing live in that vaccine. So I don't know, and I would be remiss to say anything about whatever potential vaccine is being developed for COVID. There are some vaccines out there, like the original polio vaccines and measles vaccines, where there was an element of live vaccine. Smallpox is a perfect example. There was live bacteria or virus or whatever the case may be in that vaccine, which is why people got that big pussy bump on their arm.
Right.
And the idea is that your body is fighting and building antibodies to it. Well, that's what we're doing to all vaccines we get. We're building antibodies that will give us a level of protection. The other thing that you're talking about is herd immunity. When large portions of the population have been exposed to a disease and develop a natural immunity, then you have herd immunity. And the more people that have been exposed and the more immunity there is, then the less likely the vaccine really has, the virus has no place to go.
Right.
So you do that by waiting it out. Can we afford to wait it out? Well, that's a whole lot of deaths.
Right. Well, that's a very good point. So you say, in one hand, we shelter in place, we have social distancing, and so the whole argument, do you start the economy up again? Well, I was reading a post the other day, and this doctor brought up a really great point. It's like, on one hand, we're protecting people from coronavirus. On the other hand, people that have cancer, people that have in need of open heart procedures, these people are and will die. I mean, in fact, the drug I think Merck makes for cancer has just fallen precipitously in terms of utilization because people can't go to the hospital to get cancer treatment at some level. So, this is, I was saying to somebody the other day, it's like, if you're a politician, I don't care what side of the aisle you're on. I don't care if you're Fauci or you're the guy. This is a very difficult thing to navigate through because on one hand, you don't want to see people die. On the other hand, people will die if there's no economy. There's no way to, put food on the table, pay for, housing, etc. So, boy, is this a tough one for the leaders we have in this country today to really get that balance right. Because at the end of the day, I think we're still going to lose more people to this scourge. But it's not a clear-cut answer. It's not a political talking point. It's so much more complicated than that.
I think that's again, an excellent point, and one that we don't understand totally, and that we don't give people credit for. First of all, it's really hard to not politicize this, and we have to try. We've got a group of scientists that are working their butts off trying to figure this out and trying to find a way to protect us from it, and then we've got people arguing about when we should close, when we should open, what we should do. And I understand both sides of it. I understand the economics of it really, really well. But that's not going to find us a way to really ultimately protect ourselves and huge numbers of people from this crazy virus. And I say it's crazy because, I don't know, I feel like I get inside my head and I think, if I was that virus, what would I be thinking right now? And I would be kind of laughing hysterically as we're all fighting to figure out what it is and what we're going to do about it. There's really nothing funny about it, but let the scientists be what they are. Let them be scientists. Let the politicians be what they are, because they will anyway. There's
right.
No way that we are going to intervene and stop them from.
You're not changing that behavior anytime soon.
That train left the station a long time ago. Let them do what they have to do, but the scientists have the control over it.
Right.
They're the ones that ultimately are going to find a way to help and to bring this under control in a way that suits everybody the best. And there's going to be give and take. There will be more lives lost. It's sort of inevitable. There will be some great discoveries that come out only for us to find out that they don't work quite as well as we hope they will. That's what science is all about. That's the scientific method. That's the scientific process. You try, it doesn't work. You try again, it doesn't work. You try again, it doesn't work, until you find that magic bullet that's going to do it, or at least give you the most protection that you need so that you can take a step back, breathe, and say, okay, we got this.
Right. Great point. So another big myth, and for those that have pets and animals, is that pets can spread the virus. Is there any data to support that your dog or cat can spread the coronavirus?
Well, it's really interesting. There is the first dog that's known to have, contracted the virus was in China. Keep in mind that there are about 900 million dogs in the world, and one dog, actually two dogs, but the first dog that got it was 17 years old. That's a very old dog with underlying medical conditions, who it appears contracted it from its owner. So it didn't just go out on the street one day and decide to get coronavirus.
Right.
The second dog also, the health department in China really couldn't say 100% for sure that the dog actually had it or died from it. There are a couple of cats and a couple of tigers in New York that have contracted it. The cats also, it was a matter of they were living with a sick person, a sick owner. Mm-hmm. So they appear to have gotten it from the owner, not the other way around. There are no documented cases and there is no scientific evidence that shows the pet can give it to us. So these poor little babies, and again, 900 million dogs and 2 dogs got it. I don't even know how many cats there are in the world. I couldn't.
What's that 0.000000001 infection rate?
Barely, maybe.
Maybe.
So if I were going to choose something to worry about, that would not be it.
That would not be at the top of your list.
That would not be it. That would not be at the top of my list.
So here's another myth, and it's amazing how Americans caught the clean bug. Not to play on words here, but
don't you ask yourself, what have you been doing all these years before this? Were you never cleaning your house?
Things that make you go, right? Yeah, well, you go to the grocery store and it's like, that's one place everything's sold out even today. It's like everything's got to run on the shelf. So I think people have a belief, there's a myth that you need a special disinfectant. What would your advice be to people that are trying to figure out the best way to keep their houses, clean and disinfected?
Hang on one sec. Garbage truck going by.
No worries.
First of all, simple soap and water, whether it's dishwashing soap, hand soap, the soap that you wash your clothes in, although most of those come in little pods these days. If you dilute that, that's as effective as anything that you can buy. You don't need a bottle of bleach around. You don't need a high-powered bottle of Lysol around. They're great, yeah, but if you can't get those things because the stores are out of them, take whatever cleaning product you have in your house, dilute it, and use it. It will be equally as effective.
That's a great hack because it's also probably more inexpensive than Lysol and some of the brand names.
Absolutely. I mean, any of the soap products we have, like I said, just whatever you use for dishwashing, if that's all you've got, then use it. If you think about the fact that we're told to wash our hands, which we should always have been doing. I was actually thinking about this morning, because when you have a baby, what do you do all the time?
Right.
You wash your hands.
Right.
And you wash that baby. So then when the baby grows up, all of a sudden you stop washing your hands, and then you wait until there's an illness or something going on and someone tells you to wash your something not right. But back to the soap that you use to wash your hands. If it's good enough to clean your hands and rid your hands of the virus, then it's probably good enough to clean whatever else you want to use it for too. So we don't wash our hands in Lysol, right?
Right.
We wash our hands in hand washing soap.
Or in bleach.
Or bleach.
That'd be painful.
It would be very painful. And God forbid you should have a little cut or something on your hand or your arm. Don't do that. Don't wash your body with bleach. Don't drink bleach, please. If you want the fastest track to the emergency room, drink some bleach.
That would be a good way to do it. So I also wrote a myth where, people are trying to self-diagnose and they understand it's an impact to the lungs at some level. So if I hold my breath for 10 seconds, I'm virus-free because I can breathe normally and I got lung and air capacity. So talk to us about that myth where I can hold my breath for 10 seconds and I'm virus-free.
Okay, so listen to this. You've got asthma. And you try to hold your breath for 10 seconds. What's that going to do to you?
Right.
You've got any kind of chronic respiratory illness. You try to hold your breath for 10 seconds. What's that going to do to you? You hold your breath long enough, there's this thing called a vasovagal reaction. Mm-hmm. You're going to pass out. So, maybe you don't have coronavirus, but you're now on the floor because you have asthma and you've held your breath and now you can't breathe, so you're down. You have COPD or some other lung disease and you hold your breath and now you're down. You give yourself a vasovagal reaction and you hold your breath and now you're down. There is no point and a lot of danger in trying to hold your breath, and it's not going to prove anything, because if you have any kind of underlying lung or breathing disorder, you've just hurt yourself.
Or maybe it will prove as natural selection.
There you go.
So you sort of touched on this. The other myth is drinking bleach will kill the virus. And I don't know where that started flowing around, but this is an important one to really touch on again. Talk to people about what that means, because there's some people, if you don't go deep on the facts, you say, hey, I heard someone say this, let's go do it. Now, by the way, in all fairness, I read that when that word was uttered, that this is a potential, that the sales of bleach and cleaning agents just went off the Richter scale. So there's a statistician that said, given the increase in sales of these products, that the percentage of people using them incorrectly is X, right? So that's where this whole notion took off, that people are taking bleach. They really weren't. It was a statistician trying to say, look, with this increase in sales, the probability of somebody misusing it is at this level. But having said that, what would you tell people? I mean, first of all, again, natural selection. I don't know why anybody would think that would be a good idea, but some people in fear, you said at the top of at the show, that you tend to do some things you wouldn't otherwise do. So I think this is important to sort of hit on.
Well, I mean, to go back to the fact that if you read the bottle of bleach, there's warnings all over it about what you should and shouldn't do. Presuming that you're wise enough to read what the bottles that you buy that have these powerful, disinfectants say on them. So to your point, if somebody of supposed credence tells us to do something, we are more likely to do it, because we look at who it was that issued the statement over the scientific fact, or what does it say on the bottle. Okay. So for every chemical product, and you probably know this, there's a sheet called an MSD sheet, which is a sheet that lists every known ingredient in a product, every side effect a product can cause, every danger associated with that product, and what to do in case you ingest that product.
And MSD is a medical safety data sheet, is that true?
That's correct.
Yeah.
And I would guess, my personal feeling is that if we're going to use these products in our home, we should have the MSDS sheets in our home as well. And you can kind of print them out from, online. But those sheets are great examples of basically poison. Here's what's going to happen if you drink this. Here's what it's going to do to your body. Here's the anecdote, don't do it. So for bleach or any disinfectant like that, our bodies aren't designed to handle those chemicals. These are harsh chemicals. They are used as cleaning products. We are not going to clean out our insides by ingesting these chemicals. What we're going to do is burn our intestines or kill our intestines or whatever else. Have you ever, and I'm sure you have, used bleach and just the fumes give you a headache?
Oh, yeah. When I was young, I was cleaning pools for my parents. They had a pool, and there would be chlorine and acid.
Yes.
Right? You had to do the balance. And that acid would curl it was the most pungent. Wow. And bleach is on the same order. Maybe not as intense, but no, you open that up and you can't smell it for more than a second for me, or 2 seconds.
And again, some people are much more sensitive to these things than other people. So what may or may not bother you, or at least what you don't think is bothering you, will totally bother me. Right. I'm very sensitive to that. I'm always really careful about what I use to clean my bathroom, because I know that those fumes will make my eyes water and make me start coughing.
Right.
So again, don't do something that you think will help without knowing that it's completely benign, meaning that it's not going to hurt you. And bleach will hurt you.
Yeah.
The last place you want to be right now, as you pointed out earlier, is in the hospital. It's like,
what's funny about hospitals is you go to the hospital, you think to get better, but they're really a good petri dish for a lot of different bacteria. And I've had people I've known in the hospital that pass away because they got a nosocomial infection.
That's correct.
They had lines going into their body, and it's a really harsh environment if you're sick. That's probably the place you want to avoid at all costs. So it seems to me with bleach, you want to exercise good judgment and read the fine print and just use common sense.
Absolutely. Just read the fine print. And it's interesting, what you just said about people getting sick when they go to the hospital. There's been so much criticism over the fact that people go into the hospital and they're discharged after 2 days, or they're discharged after 3 days. All of those time periods are based on the very scientific evidence that you're talking about. The sooner we get you out of there, the safer it is for you. The longer we keep you in, the more chance you have of getting a nosocomial infection.
Yeah, there's some serious bugs in those hospitals, even though, to their credit, they do everything in their power to keep it as clean as possible.
Yes, we do.
But it's literally 24/7 proposition to get that done. So getting out sooner is better. Length of stay short is better than long, for sure. So let's get practical. This has been a great discussion. So, I'm at home. I'm trying to protect my family. I'm trying to do all the right things. So what is a recommendation for such a thing as benign as a toothbrush? So I have a toothbrush. What's a recommendation for toothbrushes in terms of, because that's a bacteria, I would argue, carrier.
It is, especially if you're sick. And since we don't keep 100 toothbrushes around, and if you're sick and you use a toothbrush, do you throw it away? What do you do? And I came across this tip, which I just thought was so great. Just regular mouthwash, for those of us that use mouthwash, and most people do, has an alcohol content in it. Some alcohol-frees don't, but they still have some good disinfecting properties. And I find it incredibly useful just to fill a little Dixie cup with some mouthwash and put the toothbrush in upside down and let it stay there overnight.
And you do this daily?
In the morning is a very fresh toothbrush. And at best, you've killed most of the bacteria that's on it because of the alcohol content and the other ingredients that are in the mouthwash. It's something you have. It's simple. It's not going to hurt you. Again, I'm not telling you to drink the mouthwash. No. Don't do that. But as a nice way to disinfect your toothbrush, it's great. I still would probably throw my toothbrush away after a week or so, especially during this time period, if you can afford to do so.
Right.
If you can't afford to do so, then do whatever you can to disinfect your toothbrush. And
I think it's also about being mindful that, hey, that's a bug carrier, and
yes,
take a look at that and do that daily. So what about shoes? Can they transfer COVID-19? Because I know, in our house, I'll take it off the door, set it aside. How should we think about that? I mean, can we get COVID if I go to the grocery store and track it home to my house?
Well, it's unlikely that COVID's going to be on the floor. There's very little scientific data showing that, when you walk on the sidewalk, you're picking it up. Maybe if somebody who was a fresh sneezer and the droplets fell and they were right in that path, like maybe it could be, but they're going to be pretty inert by the time you get them home. That being said, I can't imagine a sidewalk anywhere that could be considered clean of anything.
Yeah, especially in San Francisco.
Yeah. So why do we think in the Asian countries they all take their shoes off all the time and leave them outside? I've been doing that for years and years and years because I don't like tracking dirt into my house.
Right.
So I just suggest, for any reason, if you've been out for a walk, take your shoes off and leave them outside. At the end of the day, if you don't want to keep them outside, I just spray them with a little disinfectant and wipe the soles down. I'm not quite as nuts about it as my sister, who takes a brush and scrubs. I'm like, no, I don't think you really need to do that. But I do leave them outside all day long, and I do at the end of the day spray them and wipe the soles down if I'm going to bring them in the house. Now, why do I bring them in the house? Why do I feel it necessary to do that at all? I live in an apartment building, and I'm kind of afraid to leave them out overnight because I don't know who might be walking the halls and steal my shoes, which is very paranoid. But you never know,
Oh, well, there's a homeless population out there, and they're opportunists for sure. So, it's funny, everything we're talking about is important because I think one has to have a balanced perspective. And I read this crazy story, and I'm not saying I don't understand the reaction, but these parents, this kid comes home from college in Colorado, and, the parents are on lockdown mode, right? Everything is, cleaned, the packages from UPS, Amazon. I mean, these parents went overboard, and they're not 60, they're probably mid 50s. And their 21-year-old son comes back from college, and, he's kind of getting cabin fever. And in his brain, hey, I'm young, I'm good, I'm not going to be affected. So he goes to his friend's house to party. Parents find out about it, and they call the cops on his son and have him hauled out of the house at about 2 a.m. So, what we're talking about is really helpful, but I think also it really begs that one has to have a balanced perspective. Get educated as much as possible. Don't let fear rise to the top of the surface. because it'll impact these relationships that are really vital to our lives. And when I read this story, on one hand, I've got 3 kids. I get it, because you don't want to be reckless about going places and being around people in the early stages thing. We really didn't know a lot about what it was. But boy, I think some things we're talking about is important. I just want the audience to recognize, don't go overboard and overkill to the degree to the point where it could really affect relationships.
I completely agree with you. And I think that sometimes, there is a point where you become so fearful that you probably, you mean well, one means well, and you want to protect your family, and you want to protect those that you love, and you go overboard. And when you go overboard with anything, when you become too fearful, as we stated back in the beginning, you have accidents. You begin to do things that are the opposite of safe. They're dangerous. I can't think of anything less safe than ruining a relationship because you're so fearful of that person's being sick that you go overboard and you break down those bounds of love that are so important to us right now.
Right.
And you alienate, and you don't want to alienate. This is a time where we have to do the opposite. We have to use whatever knowledge we have, and we have a lot. We know how to stay safe. We have to use that to our benefit, not to our detriment. And it's really easy when you're afraid to use information to your detriment, exactly in the scenario that you just described.
Yeah, it really is, because it really is a big impactor in long term. In fact, this kid didn't see his parents for 2 weeks, and I would argue long term that'll have a hangover effect. That's a new data point for the youngster of 21 to sort of think about as they see how parents cope and deal with stress. Because I would argue to every parent out there, you are a PhD lesson in how to deal with stressors right now.
Absolutely.
Like you lost your job, the world's falling apart, and what you model and what you demonstrate to your kids will be reproduced and will be seen again in their lives and probably their kids' lives. So, boy, it's really important that we get perspective. So let me go back. We talked about, hey, we're cleaning the shoes. What about dogs and cats? If you actually grab the cat, but what about their paws? If they're outside, should they even worry about that? Cats and dogs are coming in and out. How should they think about that?
Wiping my dog's paws down every time I take her out. I take her out 4 times a day. And I got little grooming wipes that are specifically for cats because I'm not going to use Lysol wipes on her feet. And again, because she's walking everywhere, I don't restrict where she walks. She walks in the grass, she walks in the bushes, that's their life. That's their lifeline to their own little world, is sniffing and smelling and walking. But when I bring her in, I get a grooming pad and I wipe down all of her feet. And I do that every single time. Well, first of all, it keeps your house cleaner because they're not tracking things in. And if there is anything on her paws, at least I know I've done my best to get that off. So I feel like I'm protecting her and I'm protecting my house at the same time. But I just think it's really healthy for her to have clean feet. And what do dogs do? They lick their paws, they lick everything. And cats even are worse. They lick everything that's attached to their body. I think it might be harder to wipe a cat's paws, but it's doable.
Yeah.
If you are able to do that with your cat, I don't see anything wrong with it. And again, during these times when we're most cautious about what we're bringing in and out of our houses, if we're going to wipe down an Amazon package that's traveled, God only knows how many different places in the course of its journey from the warehouse to us, then it makes sense to walk down the paws of an animal too, if you can. If your dog's not going to let you, don't fight with your dog. Don't make an enemy of your dog trying to do this. But I think it's a good idea, and I think it just adds another level of cleanliness inside our houses when we do that for our pets.
So as we're on the cleanliness wave as Americans, and we're sort of rediscovering the idea of washing hands and keeping a clean home, what are your guidelines on cell phones, keys, TV remotes, and game controllers?
Wipe them all down.
Every day?
Every day. I do it twice a day. I do it in the morning when I get up, and I do it at night before I go to bed. And if you think about TV controllers and game controllers and keys, well, keys are in our hands all the time. And if we're outside, we take our keys, whether we're getting into the car or whether we're opening the front door, or opening the mailbox. The keys are going to a lot of different places. So it makes complete sense to wipe them down. Your TV controllers and your game controllers, if you think about it, so you're having family night and you're all sitting around and you've got 4 game controllers and you're passing them around from one person to the next. Well, you hope that everybody's washed their hands, but in the event they haven't, just take something and wipe the controller down, and you know that you're safe. Because
Yeah.
we forget about things like that. Light switches. We turn light switches or lamps on and off how many times in the evening? Wipe them down before you go to bed.
Yeah. That's good. That's good common sense.
All it is common sense. It isn't being rote or paranoid. It's just common sense. And whatever you use, whether it's a disinfectant wipe or whether you take a paper towel and spray a little whatever you have on it, it doesn't really matter. Just wipe them down. Then you go to bed and they're clean for the night, right? And then when you get up in the morning, usually what I do is I get up, get the dog, take her on her morning walk, come back, wipe everything down and then that's my morning wipe down.
Yeah.
And you don't have to be nuts about it, but those things that you have in your hands all the time, your cell phone, by the way, there's guidance. You can look at on your computer, you can look at wherever on the safe way to wipe down the screen of your cell phone.
Sure.
A lot of us have cell phone, like I have a cell phone cover over the screen of my cell phone, and I just use an alcohol swab and wipe that down.
And by the way, with cell phones and touch screens, there's a study that McDonald's did. I was in Spain a couple of years ago, and the McDonald's had a touch screen, so you'd have to interface with people. And they did a study on those touch screens. There's a ton of fecal matter. Same with your phone. So It's really important to wash your hands, wash your phone, and do all the right things. Let me circle back to now what you do with California Southern University. You're the department chair of the School of Nursing. And you have a mission there, obviously, of hopefully continue the education of adults or starting the education of adults that are looking to go into nursing. So can you expand on how Cal Southern and schools are arming working adults with supplemental education and degrees that can make a difference during COVID and post-COVID?
Well, I think California Southern University is a wonderful example of how an institution can bring relevant learning to adults who want to increase and enhance their education. So in the Department of Nursing or the School of Nursing, for instance, we're not looking at people who wish to become a nurse who aren't already nurses. We're looking at the group that are already nurses and want to increase their education level to become leaders in the field or to enhance the knowledge that they already have. And one of the beauties of California Southern, I think it's a very we-oriented school with a vision that I don't think is lofty at all, but is so relevant and pertinent to today, which is to introduce adults to learning in a world they couldn't have imagined. Well, who could have imagined the world we're in right now? That mission and vision was set years ago without even knowing that we would have a pandemic and experience the kinds of things that we're experiencing now. So talk about foresight and relevance. So I am thrilled and love the fact that I can say to anyone who is interested in the healthcare field that you're dealing with a university that gets it, that really understands that in order to be successful, you have to be relevant. Mm-hmm. That in order to grow leaders who will be pertinent to the years in which they practice, whether it's nursing, law, education, it really doesn't matter. It's relevant and it has to be pertinent. And I think California Southern offers that opportunity because I think we understand the importance of really embracing the world as it is today and growing leaders who know how to handle that world.
Right. So, Johanna, as we conclude this discussion, it's been phenomenal, by the way. Is there anything we haven't covered that you'd like to share with the audience?
I think the most important thing is to circle back to fear and anxiety. And whatever the case may be, whether it's COVID or whether it's something new that appears next year, whatever the case may be, take the time to honor yourself. Give yourself the gift of honoring yourself and setting the anxiety and the fear aside and trying to look at what's happening around you with clear eyes. Look at the evidence and don't listen to the noise that's coming in from all directions. And pay attention to the things that are important to you and to your family. Because if you lose sight of that, then it's very difficult to focus on what you need to do to be safe, to stay strong, and to stay healthy. So pay attention to self. Don't be overruled and overrun by anxiety, and kick fear out the door and function on what you know to be true.
Yeah.
That's what I would leave everyone with.
That's sage advice. Johanna, really a pleasure meeting you. Really enjoyed the conversation. A lot of great tips and hacks as we go through this COVID time. Thanks so much for coming on to Beyond.
Thanks so much for having me. I really enjoyed it. And I just wish good life, good health, and love to everyone out there.
Absolutely. Thanks so much.
Okay, bye-bye.
Bye-bye.